Protect your cognitive vitality by learning how to avoid risks. Did you know that cigarette smoking has dropped by about 70% since the 1960s? This is mostly because of increased awareness about the harms of smoking. However, smoking remains one of the leading causes of early death worldwide. It also increases the risk for numerous chronic diseases, including heart disease, cancer, and dementia. Cigarettes contain thousands of toxins. Some of the most harmful are arsenic, formaldehyde, carbon monoxide, hydrogen cyanide, and lead. These chemicals can damage almost every part of your body, including your brain. How does smoking hurt the brain? Smoking causes oxidative stress, which can impair the ability of cells to produce energy. Impairments to lung and heart function trigger inflammation and reduce the delivery of blood and oxygen to the brain. Over time, these changes damage brain cells. Smoking is now recognized by the Lancet Commission on dementia as a key modifiable risk factor for cognitive decline. And it's not just smokers who are at risk. Breathing in secondhand smoke can also cause damage, even if you've never smoked. Being around cigarette smoke can expose you to the same toxic chemicals. This can lead to inflammation and oxidative stress, just like smoking directly. High exposure to secondhand smoke has also been linked to a higher risk of dementia, similar to what we see with air pollution. While cigarette smoking has gone down, vaping or using e-cigarettes is going up, especially in young adults. Vapes may seem safer, but they are not harmless. To produce an inhalable vapor, nicotine-containing liquid is heated over a metal coil. This process releases toxic metals including nickel, chromium, lead, cadmium, and antimony into the liquid, which then gets inhaled into the lungs. Lead is a neurotoxin that can harm the brain, especially in young people. The breakdown of solvents used in the liquid can also release some of the same toxic chemicals found in conventional cigarettes, such as formaldehyde. The level of toxins released from the vaping device into the smoke increases with use as residual liquid builds up and corrodes the metal parts. So, you are exposed to increasing amounts of toxins with each additional puff. It's also important to know that vaping indoors can affect others. The toxins and metals in vape smoke can settle on surfaces. This means secondhand and even third-hand exposure can still pose health risks for people living in the same space. Nicotine is addictive, so quitting is hard. It helps to have a plan and get support. Your doctor can suggest tools like nicotine gums, patches, or medications that reduce cravings. The good news is that quitting lowers your risk for dementia. People who stop smoking have a lower risk than those who keep smoking. Every day without cigarettes helps protect your brain and your body. If you are thinking about quitting, start today. There are many resources to help you succeed. Protecting your health now also helps your brain in the future. For more tips on keeping your brain healthy at every age, visit cognitivevitality.org.